Hi, everyone. My name is Dr. Stephen Lindner. I am the Associate Director for the Human Nutrition Institute at the University of Bridgeport. And I wanted to take a few moments to talk about the dual pathway where you can become a physician assistant and at time earn your master's degree in human nutrition. Now, this is such a wonderful idea. Let me tell you that my primary area of specialty is a doctor of chiropractic. I'm going on 30 years of practice. The first 15 years was traditional, conventional chiropractic care. And I would say I helped around 80% of the people. You know, that 80-20 rule that heard so much of, this universal principle of the 80-20 rule. Well, it was about 20% of the people I couldn't help. And I went back, got my master's degree in nutrition, and that filled the void. I felt like learning current nutrition, understanding labs better, the biochemistry, the pathways, the functional medicine model really helped connect the dots for me, which translated to better outcomes for the people that I'm serving in my community and better relationships with allopathic physicians. And I do work quite a bit and integrate with a variety of healthcare professionals. So, why the dual program? Well, it expands the clinical skill set beyond conventional care of what you'd be trained to be able to integrate nutrition with strong, solid, evidence based functional medicine model. It equips the future PA with tools to address the root causes, not just treating symptoms, right? So much of traditional allopathic medical model is really someone is suffering with a particular symptom and there's some sort of pharmaceutical that can suppress that. And not that that doesn't have benefits, but it isn't really correcting the cause of the problem. Okay. And I think we need to educate the people that we serve that there is a difference between symptomatic care and root cause. And when we serve people and we're taking care of sick people, typically they'll show up with different philosophies. And as a PA, a physician assistant, I think it's important for you to be aware that there is the reactive philosophy. I'm broken. Can you help fix me? And then there's the proactive mentality. Maybe they were broken. Now they're better. Can you help me stay this way? And that's what our program helps provide you, that solid foundation, that solid philosophy, and the confidence to help take care of people proactively. Yes, reactively at times, but proactively and wellness based as well. So the functional medicine mindset is a systems based approach to patient care. It seeks the root cause of the disease, not just symptomatic relief. And it uses personalized nutrition. That's the key word, personalized. It's not the same protocol for each and every individual. It's not like someone has a thyroid imbalance, everyone's going to take Synthroid, Synthroid, Synthroid. Okay, so it is a personalized nutritional core intervention. And what I wanted to present here kind of quickly is just kind of give you whet your appetite, if you would, on some of the clinical conditions that you will see as primary portal of care. People coming in with hypertension, type 2 diabetes, autoimmune issues are certainly increasing, depression and anxiety. So let's take a look at some of these from the nutritional concept and applying that functional medicine model. So a 48-year-old male presents with stage 1 hypertension, 140 over 90. What would conventional treatment be? Some sort of medication, whether it be an ACE inhibitor, whether it be a beta blocker, a calcium channel blocker, right? So in the functional approach, we applied a DASH diet and some magnesium and potassium supplementation. We talked and educated the patient on stress reduction and increased physical activity. And looked at a 3-day food diary, reduced their processed food and their sodium intake, and the outcome was that their blood pressure was reduced to 122/78 within 12 weeks. Very happy, refer tons of people to us as a result of this. Type 2 diabetes, 52-year-old female, BMI of 32, very sedentary lifestyle. You could see their labs, certainly they're a type 2 diabetic. And what was conventional medicine do? They put them on metformin and they say, make sure you exercise. But they don't have the tools, right? So we put them on a low glycemic diet, increased their fiber, applied some chromium and magnesium to their supplementation. That's the key word, supplement. It's not substitution of food, it's supplementing. We applied intermittent fasting and strength training, and the outcome was their hemoglobin A1C came down quite a bit in just 4 months to 5.7, and they're still trending down. Okay. Here's a Hashimoto's thyroiditis. So there's a 37-year-old, fatigue, the hair loss, weight gain, everything that shows a thyroid imbalance for sure. You could see their labs here, and they monitor and they put them on levothyroxine. Okay. So what the functional medicine model, we analyzed the 3-day food diet, was very high in gluten. So gluten-free diet, vitamin D supplementation because it was very low, selenium support. We focused on gut healing, a 5R program that you'll learn quite a bit about. And the outcome was that their thyroid peroxidase, right, the TPO antibodies reduced significantly from 400 down to 180. The vitamin D normalized to 56 and much improved energy in 6 months. Depression, anxiety, 26-year-old male, low mood, poor concentration, anxiety. Look at their labs, high sensitivity, CRP was elevated, the methylmalonic acid, homocysteine were elevated, vitamin D was low. They put them on selective serotonin reuptake inhibitors, and we did some methylation testing, and they were just flagged. So we put them on methylated B complex, included the omega 3s, put them on an anti inflammatory diet, some mind body practices we integrated with other healthcare professionals. Homocysteines lowered to 9, improved mood, cognition. In 8 weeks, homocysteine came down, which was tremendous. And just reporting feeling so much better. So the advantages for students, it gives you this competitive edge, right? Being able to integrate with other functional healthcare providers. You have this expanded toolkit. As a PA, you want to be able to have access to a variety of methods and tools. And being a nutritionist gives you such a broad spectrum of tools with foods, whole foods, and supplements when needed. It aligns you with the rising demand for preventative care, proactive care, holistic, comprehensive functional medicine model care. Collaborative, interdisciplinary approach. That's the key. We train future leaders in healthcare with innovating approaches, and empowers physician assistants to integrate nutrition for better patient outcomes. That's the goal. So our MS nutrition program is the most respected in the nation. We have the highest pass rates on our national board on the CNS exam, the highest in the nation. It strengthens your PA practice by uncovering biochemical imbalances. You'll have such a strong understanding of the conventional, traditional understanding of labs and the nutritional approach and the functional medicine model understanding to these biochemical imbalances. It equips you to integrate nutritional therapies with medical treatments, especially when it comes to drug induced nutrient depletions. We'll talk about that in a second. Differentiates you from competitors in healthcare field. There are many NPs, there are many PAs, right? But to be able to have something that sets you apart from the rest, tremendous. People in your community will talk about you for sure. And our program is fully online, fully online. So it gives you a lot of flexibility. In terms of drug induced nutrient depletions, I just wanted to show you these are the top 5 medications that are prescribed: statins, proton pump inhibitors, metformin, SSRIs, and ACE inhibitors. And when I look at my initial intake form with my patients and I look at the medications and I see these, it incorporates a nutritional discussion right from the very beginning because many times these drug induced nutrient depletions are the cause of the symptoms that they're coming in with. So we want to rule that out. So we look at the drug induced nutrient depletions, we make sure that we get those depletions restored, okay, and see if their symptoms subside. So statins deplete CoQ10 and vitamin D. PPIs decrease B12, magnesium, calcium, iron. My goodness, metformin, B6, B9, B12 get depleted. SSRIs decrease sodium, B6, B9, B12, and CoQ10. And the ACE inhibitors are going to decrease zinc, magnesium, and sodium, amongst other things. And you could see how what symptoms arise when these nutrients are depleted. So who's eligible? Students have to have good GPA, right? A B minus 2.75, complete all of the PA degree requirements. You can apply during the final semester of your PA coursework. The application fee is waived. You put together a personalized statement. Here is the curriculum, which you can see online. And there may be a subtle change in the near future just in terms of sequence. And I know that the vitamins and minerals course may go up 1 credit. So these are the courses that you would have waived: the anatomy and phys, the biochemistry, nutritional fundamentals, pathophys, and evidence-based. So you could get these about 14 to 16 credits waived. And these are the required courses: 560 B&E, C&G, D&H, F and K. But the program would only take you a year and 4 months. Okay, that's it. Maybe a year and a half tops, 1.5 years. Total credit requirement between 28 and 30 credits. So taking our program gives you such a nice competitive edge. And I really do hope you consider it because it really sets you aside from the rest of the PAs. And the goal here is to really be able to help people with a variety of methods, but nutrition can apply to every single human being. Everyone can improve in some form or fashion, either utilizing it reactively, but more people today, when we look at a lot of governmental incentives, it's to help people get healthier. Our communities are very sick and they need people with nutritional knowledge that are credentialed to help people get well. If you'd like more information, you can contact our director, Linda Fleming, myself, Dr. Lindner, and our program coordinator, Carla.